Okay, good day everyone, and this would be the last part of our discussion on the nursing process. So for this video, we'll be having planning, implementation, and evaluation. So the last three phases of the nursing process. Okay, now for the planning, so this is the third phase in the nursing process. It aims to develop an individualized plan of care that identifies client goals and desired outcome. So take note, this phase is done in coordination with the client because you, as the nurse, will help your client to meet a goal that you both have decided to achieve. This phase may involve activities to prevent, reduce, or resolve identified priority client problems. At this point, you may determine how you can support your client's strengths and capabilities towards a positive health outcome. So to review the different activities involved in the planning phase of the nursing process. So primarily, the goal, as I had mentioned a while ago, is to develop an individualized plan of care. Okay, so the different activities involved in this phase is number one, you set priorities. Okay, so with setting priorities, we'll be having a review of what we had discussed from the last topic regarding how do we identify which is the problem that we would pay particular attention and would first focus on. Okay, so you write the short and long-term goals or outcomes in collaboration with your client. Select specified nursing interventions that would achieve your written goals and objectives. Okay, and then of course you write nursing orders and the nursing care plan. So basically at this point, this is the writing phase of your nursing care plan. Okay, so as I had mentioned, let us review how do we prioritize our identified problems from a list of the problems that we're able to enumerate during the nursing diagnosis phase. So our main framework to establish the priority problem is we use Maslow's hierarchy of needs. Okay, so Maslow's hierarchy of needs can help prioritize patients' problem and may help you on your clinical rotation and of course on any nursing examinations. Give it a chance that you were asked which problem would you prioritize first. Okay, so for the first, okay, the most basic and the foundation for the different needs of the patient according to Maslow is physiologic. Okay, so for ABCs, for airway, breathing, circulation, think physiologic, or these are your basic human needs, for which you may start with oxygenation, water, and nutritional needs of your patient. Okay. Next, you have safety and security. So for the altered level of consciousness and sepsis or infection, think safety and security because altered level of consciousness and sepsis can lead to confusion, okay, and of course, safety issues. Next, you have for acute pain and any untreated medical conditions, think love and belongingness because love and affection goes into helping people with pain and untreated medical problems. Okay, next you have for education and feelings or education needs and the feelings of your client, think esteem because esteem needs deal with achievement and respect. Okay, and for a patient waiting to be discharged, so we call them MGH or may go home patients, okay, think self-actualization and reaching one's full health potential because the patient now is ready to go back to his usual day-to-day living prior to hospitalization. Okay, now, so how do we categorize them? Okay, so these are our specific guidelines for prioritizing. Okay, so designate high priority to first level priority for problems like ABCs or airway, breathing, and circulation, and these are called to be life-threatening problems. Okay, what can kill your patient. Okay. So for airway, okay, you should be focusing, okay, if your patient is unable to ventilate, okay, when you say ventilate, okay, achieving enough oxygen supply with every inhalation and exhalation, okay. Signs of airway obstruction to look for in any scenario, in any patient, may include abnormal chest and abdominal movement, blue or mottled skin, and expiratory wheezing or gargling. Okay. Next, you have for breathing. Breathing function should be assessed after the airway is managed. So assessment of breathing is intended to identify signs of respiratory distress like abdominal breathing, central cyanosis, okay, shallow and rapid breathing, and unequal chest movement. Okay. And then you have circulation. Circulation should be assessed after airway and breathing have been evaluated and managed. Okay. Some of the causes of poor circulation include shock, heart failure, and pulmonary embolism. So some signs to look forward, okay, to anticipate for problems with circulation may involve low blood pressure, cold peripheral skin temperature, and poor or delayed capillary refill. Okay, so these are our first priority problems, okay, or we call them life-threatening problems. Those situations which can kill your patient. Okay. Next, you have second level priority items are called the health-threatening problems, okay, which includes your mnemonic MAAUAR. Okay, so that includes mental status change, acute pain, acute urinary elimination problems, untreated medical problems, abnormal laboratory values, and risk for infection. Okay, so under these, this requires prompt intervention after, of course, providing care for patients who have life-threatening problems. Why is health-threatening problems second in priority? Because if we provide care to these kinds of patients who are having these kinds of trouble, we can prevent further health deterioration. Okay. So regarding mental status change or your altered level of consciousness, it is considered a patient safety concern and it is prioritized if ABC is not a concern. Okay? So a patient with altered level of consciousness should receive more in-depth assessment because the patient is at risk for obtaining or sustaining falls, okay, and may sometimes hurt themselves. Okay? A change in mental status may also indicate a change in brain function like confusion, amnesia, loss of alertness, problems in judgment or thought. Okay? And if mental status changes are neglected, this can lead to injury, fall, or permanent brain damages. Okay. Next, acute pain. So under acute pain, we also have their sepsis, okay, or infection. These are priority problems because this can cause sepsis, can cause confusion, breathing changes, and elevated heart temperature. Okay, so managing sepsis can lead to preventing the occurrence of additional health issues. Okay, acute pain, okay, is also on the same note as sepsis because acute pain can reveal the presence of actual or any potential tissue damage. Pain often means that patient, or according to the patient, would mean that there is something wrong. Okay? Untreated pain can lead to muscle tension, restricted movement, skin breakdown, or may precipitate infection. Okay? Pain is of lower priority compared to mental status changes and infection because it is manageable. Okay? And they can be tolerated from one patient over the other. Okay? And of course, if not on the extreme note, a patient cannot die from pain. Okay? Next, you have acute urinary elimination problems. This could suggest obstructions in the bladder, okay, or in the urethra. Complications of untreated urinary retention can lead to urinary tract infection, bladder damage, and chronic kidney failure. Okay? Next, you have untreated medical problems. Okay? So untreated medical problems can lead to a quick deterioration of a patient's health or even death. Like for a patient who is diabetic who needs insulin, without insulin, the patient could experience diabetic ketoacidosis, a complication. Okay? So, on any examination or in any scenario on your actual clinical rotation, diabetic patients needing insulin, okay, may require or may have or may be presented with abnormal laboratory results and can pose higher risk for infection. Okay. Next, you have your abnormal laboratory values. Okay. So this can signify potential severe problems and may require further investigation. Okay. Because this can lead to possible problems with your liver, heart, or kidneys depending on which laboratory test or which laboratory result is elevated or decreased. Okay? It is also essential to address risks for infection to prevent further occurrences of infection. Okay? So this can cause inflammation, pain, delayed wound healing, okay, sepsis, and even death. And finally, attend to third level priorities. These are matters essential to a patient's health but can be attended to after the more critical health problems are addressed. Okay, so we call them long-term treatments or long-term interventions. Okay, so this would include maybe problems regarding lack of knowledge, mobility, family coping, activity, and rest. Okay. Education or level of knowledge is prioritized after all health concerns are handled. Okay? Of course, education is important, but will not directly deteriorate a patient's health. Okay? Patients' feelings regarding coping, okay, are important when it comes to overall health, but feelings can wait until more critical problems are managed. Okay? And of course, those patients who are waiting to be discharged, okay, this patient can be of last priority. So the patient may become irritated and impatient regarding waiting for a longer period of time for him to be discharged. But patients with health concerns, of course, are more priority. Okay. Now, to compare with the different guidelines for prioritizing and where can this problems be plotted on the Maslow's hierarchy of needs. Take a look at this example. Okay, so the first or the life-threatening problems from our guidelines for prioritizing is under the physiologic part of the Maslow's hierarchy of needs, the most basic. Okay? Next, you have health-threatening problems belongs to second level and third level of the Maslow's hierarchy. You have safety and security, love and belongingness. And that of long-term treatment belongs to the topmost tier. You have esteem needs and self-actualization needs. Okay, so that is how the Maslow's hierarchy of need, is the best framework to describe how you would prioritize patient problems. Okay, now since we're done with prioritizing, okay, so let us proceed with planning. So goals, as we had mentioned, we discussed under planning, so we establish goals and desired outcomes. So goals here should be written following the popular SMART method. You have specific, measurable, attainable, realistic, and time-bounded. Okay. Okay, now let us proceed with how do we differentiate goals from your desired outcomes. Okay. So we talk about goals. Goals are broad statements, while desired outcomes are stated specifically. Okay. Like say for example, your goal is to improve ambulation, so the manner a patient walks, okay, or move. Now, when we translate that into specific ways, or we rephrase improve ambulations within manners for which we can actually measure. Okay, we may say be able to walk 200 meters every day. Okay, so when we compare, improving ambulation would also mean that the patient would be able to walk 200 meters every day. Okay, so we most often than not prefer using desired outcomes rather than stating our goals. Okay, so take into consideration that when we write our planning, okay, we make sure that we write desired outcomes instead of goals. Why? Because by being specific with the things that you would want to observe, okay, make sure that these are measurable so that you can be able to identify, okay, and discriminate changes from an initial data towards another data that is gathered after, of course, performing all the necessary interventions that you had provided. Okay. Now, there are two types of goals. Those that can be achieved in a short period of time are called short-term goals. Okay. This can be in days. Okay. This can be in hours. This can be in less than a week or so. Okay. So this is applicable to patients that require health care for a shorter period of time. Then, of course, there are goals that can be achieved in weeks or months. So they are called long-term goals. So these kinds of goals are used for clients who are at home, okay, those with chronic conditions, or those patients in long-term nursing care facilities, or those in rehabilitation centers. Okay. Now, on your nurse's pocket guide to guide you in writing your desired goals or desired outcome, okay? So, the North American Nursing Association for Nursing Diagnosis had already identified all possible desired outcomes for every diagnostic label. Take an example for the diagnostic label breathing pattern, okay, and the nursing diagnosis ineffective breathing pattern. We have the following desired outcomes. Okay, for example, the client will be able to establish a normal, effective respiratory pattern as evidences by the absence of cyanosis and other signs and symptoms of hypoxia, with your ABGs within normal limits or acceptable range. So that's one desired outcome. Verbalize awareness of causative factors. Okay, the client will be able to initiate lifestyle changes. The client will be able to demonstrate appropriate coping behaviors. So these are our desired outcomes. So for your patient and your case scenario, be able to choose which desired outcome do you think would be applicable to your patient's case at the moment. Of course, we pay particular attention to providing relief for any current or actual problem over those about education, lifestyle changes, and coping behaviors, which are, of course, definitely under the long-term needs of your patients or long-term priority care for your patients. Okay. Next, there are different components, of course, of a outcome statements. So before we can do that, no, let us take into consideration what are the different components of an outcome statements. Okay. You have here your subject, your verb, the different conditions, and the criterion of the desired outcomes. So what do they mean by these components, and how can this be seen on your desired outcome statements? Okay, so the noun, of course, is the subject. In this case, it is your client. The verb specifies an action the client is expected to perform. What do you want your patient to do? Okay. Conditions. These are added to the verb to explain or answer the question what, okay, where, when, or how. Okay. And your criterion of desired outcomes is the level to which the client will perform the specified behavior in terms of time, speed, accuracy, distance, and quality. Okay. So let's take into consideration our example here. Okay. For example, the client here is your subject. Okay. The verb here is walk. Okay. Things that you would want the patient to do. Okay. And then you have here conditions. Okay. What, when, where, or how. So those are the questions that you need to answer. Okay. Independently, I would want my client to independently walk. Okay. Where? Okay. You have the hallway. So I would want my client to independently walk this hallway. Okay. So this means these are your condition. Okay. And then you have your criterion of desired outcomes. Okay. So criterion of desired outcome specifies, okay, what are the things that your client can do pertaining to a particular specific conditions that you would be setting. Okay, so you mentioned where will the client walk independently. So you said the hallway, but how do you know, or how would you know that the client can walk, no, or at which starting point and at which ending point would the client be able to walk? Okay, so you may say the length of the hallway, meaning from the starting point of the hallway to the end part of the hallway, so the entire length of the hallway. Okay, and then you also take into consideration, be able to set a time frame. Okay, a range for which the client will be able to achieve such condition. Okay, so here I had said after 6 to 8 hours of nursing intervention. Okay, so that is my criterion of the desired outcome. Okay, the length of the hallway. Okay, he will walk there, and of course after 6 to 8 hours of my intervention. Okay. So that is a very good example of a properly written desired outcome. Okay. Now, there are different guidelines for writing your nursing care plan. Okay. As I had mentioned, this phase of the planning phase is the writing phase. Okay. Of course, it is necessary that you provide a date and you sign the plan, because this indicates that you, the nurse with this particular name, is the one who had developed this particular plan in coordination with your patient. Okay? Use category headings. So you have there on your template, assessment, planning, assessment, nursing diagnosis, planning, implementation, and evaluation. Take into consideration to use standardized or approved medical or English symbols and keywords. Okay, so this is to let your readers understand, okay, the different terms that you are stating from your plan. Of course, be specific, most especially on your goals. Okay, Refer to procedure book or other sources rather than including steps. Okay? Like say for example, I need to feed my patient. So you mentioned on your interventions to provide nasogastric tube feeding to my patient. Okay? So instead of saying this is the first step for nasogastric tube feeding, okay, you mention the procedure itself instead of saying step number 1 and step number 2 and so on until you finish the different steps involved in that particular procedure. Okay? Tailor the plan to your client. As we had mentioned, you need to take into consideration to choose the necessary or the immediate need of your patient. Okay? Like say for example, if you would go back with the desired outcomes for breathing pattern, the first one is to provide immediate answer. No? Establish a way to minimize or remove causes of ineffective breathing pattern instead of identifying the causative factors, identifying coping mechanisms. Okay? Provide prevention and health maintenance interventions. Okay, so you need to incorporate health teachings regarding, okay, how to prevent the occurrence of a possible complication and how to maintain properly their health. Okay? Include interventions for ongoing assessment. So it doesn't mean that you are already on the planning or the intervention phase. You no longer need to provide interventions that is aimed towards reassessing or continuously assessing your client's condition. Okay? Include collaborative and coordination activities. Okay? Collaborative meaning the different members of the healthcare team, and coordination activities requires those of dependent nursing responsibilities. And of course, if the patient is in the hospital, you need to include plans for the client that he or she can follow once they are already at home. Okay, so that is the different guidelines that you can use when you are writing your nursing care plan under the planning phase. Okay, so at this point, you are now ready to establish or to craft your planning for the case scenario that we had for your section. Okay. Now, to proceed with the implementation phase of the nursing process, okay, so basically under the implementation phase, this is the doing phase. Okay, so under the doing phase, we actually perform what are the things that we had identified, that the things under the planning, the things that we had identified to be performing to your client. So ano ba yung mga sinabi natin sa planning phase natin na ito yung mga gagawin natin? Okay? So under the implementation, this is based on the first 3 phases. So nursing activities and client responses are examined, and nursing activities are individualized based on the different assessment data that you have. Okay. So the goal of the implementation is to assist the client to meet the desired goals or desired outcomes that we had set under planning. Okay. So activities in the implementation may involve or involves reassessing the client, determining the need for assistance, implementing or actually doing the nursing interventions, supervising the delegated care, and of course, documenting the procedures that you had performed to the client. Because as we have mentioned, anything that is done to your patient but is not documented is considered not done. Okay. So there are different types of nursing interventions. First are those independent interventions for which the client are authorized or licensed to initiate and perform. Okay? Then you have dependent nursing intervention. These are executed under the physician's order and directions. Okay? And then you have collaborative interventions. Okay? The nurse carries out activities, okay, in collaboration with the other members of the healthcare team. Okay? So to guide you in selecting your interventions, the Nurse's Pocket Guide has already identified all possible interventions towards achieving a particular desired outcomes that was initially stated under the desired outcomes section of the Nurse's Pocket Guide. Okay, so take a look at the example presented for breathing pattern. Be careful, of course, in choosing each of the interventions. Okay, so you have here, these are the interventions towards providing relief of the causative factors of ineffective breathing pattern. Okay, so pay particular attention to interventions that is only applicable to your client. So interventions should be chosen on the basis of your individual client condition. Okay. Next. So don't forget, what are the different types of interventions? Okay. So they are grouped according to independent, dependent, and collaborative. So you have I, B, C, like I don't care. Okay. So to help you remember the different types of nursing interventions. Okay. Now, successful implementation of the stated, identified, and enumerated nursing interventions requires that a nurse should have these three. Okay? So we'd say cognitive skills, no? This involves the background knowledge, okay? Being able to have the necessary rationale, okay, or reasons for doing a particular intervention to a patient manifesting this particular condition. Okay? It also involves problem-solving skills, decision-making skills as well, okay? Critical thinking, and of course, creativity. Okay? Then you have interpersonal skills. Of course, no, the use of verbal and non-verbal communication, and this effectiveness depends largely on a nurse's ability to communicate. Okay? Being able to integrate the use of therapeutic communication techniques. Okay? Having the necessary knowledge. Okay? Portraying the necessary attitude and feelings and interest towards your client. And of course, being able to integrate cultural differences, no, respecting values and lifestyle of every patient. Okay? And of course, technical skills, no? So this involves the technical know-how or the hands-on skills. So often called tasks, procedures, or psychomotor skills. However, psychomotor skills refers to physical actions that are controlled by the mind and are not reflexive. Okay? So definitely, it requires knowledge and frequent manual dexterity. Okay, so being able to perform the procedure with ease and comfort. Okay, now, so to understand, okay, and identify the different dependent, independent, and collaborative interventions, I have here an example. Okay, a scenario. Nurse Anna has set interventions to achieve the goals towards effective airway clearance. So this includes assessing breathing pattern, performing deep breathing and coughing exercises every 4 hours, daily postural drainage, increasing fluid intake to 3 liters daily, performing nebulization of salbutamol 2.5 mg 3 times a day, obtaining a complete blood count, and getting sputum examination culture and sensitivity, and taking an X-ray. Okay, so from the given interventions, which here are independent nursing interventions, dependent, and collaborative nursing interventions. Okay, so I have here highlighted in yellow. So what do you think? What are these type of interventions? Yes, they are independent nursing interventions. Okay. Next you have here, what about this highlighted in pink? Okay. Yes, these are dependent nursing interventions. Okay. What about this one? So, I think they overlap, ma'am. Okay. You could take a look. Obtaining complete blood count, getting sputum examination, culture and sensitivity, and taking x-ray is also part of the dependent nursing responsibility, but is also a collaborative interventions. Okay. Why it is under the dependent nursing responsibility? Okay. Because the doctors are the ones who prescribe or who orders for such laboratory tests. Okay, so that's why it's a dependent. Okay, so we carry out the order of the doctor. However, okay, performing such laboratory test requires that you coordinate with the different members of the healthcare team, making it collaborative nursing interventions. Okay? Okay, so obtaining a complete blood count, sputum examination, okay, requires coordination with the medical technologists, okay, and they have taking x-rays requires coordination with the radiology department, okay. Now, one questions that nursing students has is how much nursing interventions is required for me to know that my interventions are already enough. Okay. This may be helpful for you. Okay. This is a checklist so you can verify if your developed plan of interventions are sufficient enough to, okay, to be called correct, okay, or to be evaluated correct. Okay, so look at this task in your developed interventions. If you have at least a total of 8 out of 10, okay, then your set of interventions is good to go. Okay, take a look at your identified interventions. Did you reassess your client? Okay, did you organize your resources? Did you anticipate the need for assistance? Okay, were you able to delegate tasks to other members of the nursing service? Okay. Did you provided direct care? Okay. Did you provide counseling? Okay. Do you provided options for your client to choose from? Okay. Were you able to teach the client and the family? Okay. If there are doctor's order, were you able to carry them out? Okay. Were you able to make referrals to the other members of the healthcare team or maybe other physician? Okay. And were you able to document your care? Okay. So if you were able to check 8 out of 10 among these interventions, among this checklist, then your set of interventions are good to go. Okay. And the last phase, which is evaluation, of course, is not the least. Okay. The activities involved under evaluation, okay, is definitely to determine whether do you need to continue your plan of care, or do you need to modify them, or maybe do you need to terminate them. Okay. So activities involved here is to determine if your goals, okay, have been achieved by reassessing your client's baseline data. So under your assessment, let us look for them once again. Is this still present on your patient? Okay. Now, after which, review and modify your plan of care if the goals were not achieved. Okay. So at this point, you would be asking yourself, did our plan work? So the nurse at this point reassess the client using the same methods used in the assessment phase. Okay, so are the problems from the start still present after performing all the necessary interventions? Okay. The nurse will also identify factors that positively or negatively affected goal achievement. Okay, so the reassessment of your client will tell you if your goals were met, partially met, or not met. Okay, so to help you decide if your plan of care worked, use this guide question. Okay, were the interventions effective? Were the interventions really influenced by the outcomes to be met, or an outside factor occurred? Okay. Do you have incomplete assessment data? Or maybe you were able to identify an inappropriate outcome statement. Okay. You were able to identify inappropriate interventions. Or maybe your interventions were not carried out properly. Okay. So these are the things you take into consideration when you are evaluating. Okay. And lastly, say this is our planning statement. The client will independently walk the length of the hallway after 6 to 8 hours of nursing interventions. And for our evaluation statement, the client was able to independently walk the length of the hallway after 6 hours of nursing intervention. Okay, so take a look at this. On your planning statement, it is stated in future tense. But on the evaluation statement, it was stated in past tense. Okay, because the interventions were already done. Okay? And if on your planning statement you have arranged for the time frame, okay, here the time is already exact. At which particular time were you able to achieve your goal? Okay? So specific. Okay. So at this point, then you are now ready to evaluate your client. Okay, and this is the end of the nursing process. So at this point, you may now start writing your planning statement, your interventions, and your evaluation statement for your assigned case scenario.